I'm Dr. Wendy Askew, and I'm a gynecologist and a functional medicine physician in San Antonio, Texas, and I'm also a patient, and I am Alethiah. My practice is gynecology. I do lots of hormone replacement therapy, but I do functional medicine. And as a functional medicine doctor, you consider the whole patient. And so you talk to them about all their other conditions and systems. And of course, as we're taking their history, I might see if they suffer from anxiety or depression or spasticity, multiple sclerosis. So many people suffer from autoimmune disorders, and all of these conditions are just some that CBD can act upon. So I always introduce the topic to them if they express to me any concerns about the conditions that they're suffering from, or if they're not getting good response from their medications. So I always tell patients that CBD is something that might be able to help them if they suffer from some of these conditions. And what I see in my patients is tremendous improvement. Gratitude, they're always thrilled that they're able to treat their conditions more effectively with an agent that is holistic, that is safe, that is very, very holistic, and get better relief than they'd gotten from so many years of prescriptions and medications and all kinds of side effects. So some of the most effective treatments, insomnia, anxiety, the autoimmune disorders, a lot of the chronic pain patients get some improvement in their pain control by adding a CBD compound. And so I just love sharing it with all my patients if I think it has any place in their life and their wellness that it might benefit them, and I am seeing tremendous responses. I can think of one patient that I just adore who has terrible insomnia and had been on agents like Ambien and Lunesta, Trazodone, and all of those, and she just couldn't sleep. And I had talked to her about meditation and about, all of good sleep hygiene, not watching screens and going to bed at the same time. She tried all of those things, but her brain just would not turn off. And so after I talked to her about CBD and we discussed its place and how to try it, she was so scared to not be able to sleep and come off of her prescriptions. But she did it. And within a couple of weeks, she was sleeping better, getting longer durations of sleep, fewer wake-ups, and now she's getting 6+ hours a night, uninterrupted sleep with her CBD oil, with Alethiah, and feeling great, and she says she rarely needs to take a prescription to help her sleep. I have several patients who suffer from anxiety, such a common disorder, so prevalent, and we have such poor treatments for it. The SSRI medications don't always do a great job controlling anxiety, and the benzodiazepines are awful and addictive, and they make you sedated and groggy. So I have several patients who have switched to using Alethiah for their anxiety and are getting incredible results. Much calmer, much less of the heart palpitations, the fear, the overexcitement, hyperstimulation, and it's really impacting their life in a beneficial way. So I'm very excited about those patients. I have a lot of patients with autoimmune disorders. So things like rheumatoid arthritis, where they tend to have a lot of joint pains and swelling and inflammation. Patients do very well with autoimmune conditions, treating it with Alethiah, because it does such a good job modulating the overactive components in our immune system, so they can get relief. Some of them have been able to come off of some of their medications, and some of them are simply able to use their medications less often. And we talk about the dosing and how to work the dosing in around their prescription drugs if they still need them, but very good responses in autoimmune disorders. With cannabis medicines, the rule is to start low and go slow, to increase your dose gradually over time, because what everybody has with cannabis medicine, and CBD specifically, is a therapeutic window. So if you think about it analogous to, say, a painkiller. If you take one Advil, you might get a little bit of improvement with your headache, but if you take 4, you should get a much better response. But with CBD oil, that's not exactly how it works. Often, you will get a good response at a lower dose or at one particular range called your therapeutic window. And that's why some doctors find it difficult, but patients need to find their therapeutic window. So what we have them do is I like to have them start with either the 500 or the 1,000 milligram vial, and then begin with a half of an ml, which is half of a dropperful. And I instruct them to place the tincture under their tongue, hold it there for 90 seconds, and then swallow whatever has not absorbed. And to do that twice a day. Occasionally I'll have them do it 3 times a day, sometimes for anxiety or other conditions. But then to stay at that dose for a week, maybe 2 weeks, sometimes not as long. For a condition like anxiety, they would be able to tell right away if their symptoms are improved. But for a condition like psoriasis, it might take 2 or 3 days until I can see that the little plaques on my skin are starting to heal and regress. So once you can determine improvement, you might try increasing your dose a little bit more, but you don't want to keep going up higher because you won't necessarily get more and more benefit, and you might lose your control. So once you get to a point, whether it's 1 ml twice a day, a half an ml, 3/4, and you have your pain, your skin rashes, your asthma, your anxiety improved or well controlled, then stay at that dose, and you don't need to vary unless you start to feel your symptoms recurring.